Thank you for joining today's webinar. This is a health education and learning program webinar, and the topic today is services to jumpstart and assist in the transition from volume to value. By participating in this webinar, participants will be able to describe how service line expansion and transition to value impact long-term organizational viability, identify components of process improvement leading to enhanced service delivery, and describe services currently delivered that may have a positive impact on the transition to value by applying process improvement practices to enhance service delivery. With that, I'd like to welcome our speaker, Tammy Norville. She's the Technical Assistance Director with the National Organization of State Offices of Rural Health. Tammy joined Nosor as a Technical Assistance Director after serving several safety net providers for almost 15 years in the North Carolina Department of Health and Human Services Office of Rural Health. As the University of North Carolina at Chapel Hill graduate, Tammy brings a myriad of experiences and expertise to her role, including leadership, development, facilitation of collaborative partnerships, program and regulatory compliance, coding, billing, and documentation, as well as capacity and skill development for State Office of Rural Health and stakeholders. Tammy maintains a certified professional coder instructor, certified professional coder, registered medical coder, registered medical biller, and registered medical manager certifications. We're so honored to have you with us here today again, Tammy. And I think at this point, I will turn it over to you.
Awesome. Thanks so much for having me. I love your pop-up poll. That's great. I hope we're going to have a good time today. So if y'all have questions, please pop them in the chat. And Angie's going to help me watch the chat because I stink at talking and trying to look at the chat at the same time. Just not that coordinated. So let's jump right in. And Angie already talked about the learning objectives. So they're here for you to read once you get the slides. So there's that. Our roadmap for today, we're going to spend a minute getting to know each other, and hopefully you were here last time, so you know us a little bit. And then we're going to really jump into service lines and viability of your organization and process improvement and maybe give you even some tips of things that you're already doing that you can just kind of enhance a little bit that can really impact your business. Special thanks to Nosor's long-term partner, the National Rural Health Resource Center, for providing the opportunity for me to be with y'all today. We really value our partnership with them and hope that if you haven't had the opportunity to work closely with them in the past through this RHPTP opportunity, this is a great opportunity to really foster a relationship and work towards future partnerships and their assistance. They're awesome. So a little bit about you. I'd love to know kind of what your positions are and what kind of provider you work for. So what's your organization? Is it a rural health clinic? Is it a critical access hospital? Are you the CEO? Are you a clinical support person? Just a little bit about you. And then what do you hope to get out of today's session? I always like to kind of look at the chat after a session like we're going to have today and just kind of see where you guys were when we started and then kind of gauge it at the end. So there's a little bit about me. Not going to spend any time on that because these are the most important things about me. I'm a fur mama to Buster and Ryder. Buster is an 11-year-old pug and Ryder is about a 5.5-year-old rescue. And the National Organization of State Offices of Rural Health, which is my employer, affectionately known as Nosor, our mission is to provide capacity building and support to state offices of rural health across the country and their stakeholders. We are the member organization of all of those state offices across the country. There are several slides in this deck that will share information about what state offices do, as well as things Nosor does, like providing toolkits and performance measures and benchmarking and things like that. You can go to nosor.org for additional information and find great kinds of resources. And state offices of rural health have three main focuses: information dissemination, rural health coordination, and technical assistance. So your state office of rural health can provide assistance to you as you provide services to your neighbors in your rural communities. And if you aren't familiar with your state office, you can go to that same nosor.org and find a listing of state offices of rural health by state. And it gives a little information, contact information, and names of folks in particular areas if they have different areas within their office. And the important thing to remember is we're all working towards the same goal. We all are trying to help our rural communities become more well, despite the fact that we all know rural communities are generally older, sicker, and poorer than our urban and or metropolitan counterparts. Our goal is the same. Nosor, state offices of rural health, and you guys, as well as our partners like the National Rural Health Resource Center, putting together opportunities like this to help us move the power of rural forward. And speaking of the power of rural, if you've not heard about the power of rural, check out powerofrural.org and mark your calendar for November 18th. That is National Rural Health Day. If you've never celebrated before, not only is it a great day to have cake, it's a wonderful day to celebrate rural. It was created, and the Power of Rural was created to shine a light on the unique characteristics of rural and rural health. So I hope you'll celebrate with us. Power of Rural has 4 tenets, if you will: collaborate, educate, communicate, and innovate. As we go through today, and actually any of the sessions that you're with me, I ask that you keep those tenets kind of in the back of your mind, because I think you'll find as we kind of go through this journey that rural health has these 4 tenets interwoven into its very DNA. It is the power of rural. We do collaborate and educate our communities and communicate with our partners and innovate because we have to be successful. And that is what the power of rural is all about. So as we go along, again, see if you can kind of think about how these 4 tenets or concepts might impact operational efficiency of the business of rural health. We talk about the mission a lot, but I'm coming at today's topic from a more business perspective. A lot of us went into rural health in whatever capacity to serve our rural neighbors, to serve our rural communities. But at the end of the day, we are a mission-driven business, no matter what level or perspective you come at rural health from. So just kind of keep that in the back of your mind, because operational efficiency is really the forward momentum that pushes us along on our journey to value. So just want to keep that in the back of our minds. So our question of the day: why?
Tammy?
Yes.
Excuse me, this is Angie. Before we get too far in, I wanted to share with you, we have some responses in the chat box to who's on the line and what are they hoping to get out of today's presentation.
Oh, that would be great. So
Okay, so I'll just share. We have a program evaluator, state public health, interested in how to support partners in transition through grant strategies and projects. And then we have an administrator interested in learning more about the transition from volume to value to help our clinic bridge the gap.
Awesome.
And that was, I think that's just the 2 that we had so far.
Great. Wonderful. Thank you so much, Angie. So you might be asking yourself, why is she asking why? I'm glad you asked me that question. Because why do you do what you do in the way that you do it? When you sit back and look at your practice or hospital or department, whatever it may be, why do you do what you do in the way that you do it? If you have thoughts, just drop them in the chat and we'll get some of those going. So why is it important to understand why your organization does what it does in the way that it does it? Some of you might have heard of Simon Sinek. He's a leadership skills development guru guy. He's on YouTube and does TED Talks, and he's an author. He has several books, and they do classes and all kinds of things. He talks about the importance of and getting to know the why of your business. That's how you make impact, being able to convey that why. It's not what you do, it's what you believe. The belief is the why. If you watch TED Talks and the like, you might have seen Mr. Sinek talk about the golden circle, starting with the why. That's kind of what he calls this. There's several of his videos on YouTube that have the same clip that I have here for you. This is the short 3-minute version of a much longer session, but it's focused on the why and the golden circle. I guarantee you it will be 3 minutes well spent. I strongly encourage you to take time to do that. But you might be asking yourself, so Tammy, why are you harping on getting to the why? And I am so glad you asked, because when you think of the why we do what we do in the way that we do it, that's really the heart of our mission. I believe it's the crux of value. It's what value is built on, so to speak. And to begin to tell the story of value, the value of the services provided to our patients, which is what value ultimately is, we have to start with the understanding of why we provided the services that we provided in the way that we provided them. That's the why we do what we do in the way that we do it. So what I'm talking about when I say we have to start telling the story of services, what am I talking about? It all starts with medical necessity. So what is medical necessity? It's the who, what, when, where, why, and how of services provided. It describes in detail what service was needed, why we performed the service, how the service was performed, who performed the service, what provider type, and where the services are performed. The answers to these questions not only establish medical necessity, that big term that we like to use, but it also describes and demonstrates the intensity and complexity of the services provided. This is the heart of the why we do what we do. This is getting to that why, the heart of the story. And the reason we do what we do is the reason we're chasing high quality and high value. The why we do what we do in the way that we do it is to help our patients and communities to become more well. That is our ultimate goal. So we're going to talk about this from a couple perspectives today. But one I'd like you to keep in mind, the operational perspective. I kind of said that earlier. Think of your healthcare business as a building or a puzzle. It takes components or pieces to make the entire picture, to tell the whole story. That's how we'll approach our time together today. So let's think about what are some things that might work within the parameters of the transition or journey to value, however you think of it, and might impact organizational long-term viability. Let's talk service lines. So you might be asking, what's a service line? And again, I'm glad you asked. So for our purposes, service lines are defined as an easily identifiable service provided, generally within the same CPT or ICD-10 code family. For example, behavioral health integrated into primary care would be two service lines, behavioral health and primary care. Does that make sense? So you'd basically have behavioral health codes and you'd have, say, evaluation and management or preventive codes. So there are examples of service lines, especially in hospitals, that they have a much more complex, not only definition, but real processes that they consider, and I'm using air quotes, you can't see, service lines. But for our purposes, we're really narrowing that focus and really simplifying our definition to services that basically fall within a CPT family or an ICD-10 code family, just for simplicity. So I already kind of talked about this. So here are some current service lines that you might have, right? You might have integrated behavioral health. You might be doing chronic care management. You might have a pediatrics practice within your rural health clinic or affiliated with your hospital. Transitional care management, oral care. What about nursing homes? Home health, that's a big one, right? Because our rural populations are aging at a faster rate than most other parts of our country. So, which of these service lines do y'all already have? Do you have multiple service lines, specifically in your clinics, but affiliated with your hospitals maybe? Do they really tell the story of the services that you're providing? The big question, I guess, is do they have impact on patient outcomes? Since you've integrated that service or added that service line, have you seen a positive impact on patient outcomes? And do any of these service lines have an impact on long-term sustainability? We're going to actually talk pretty specifically about chronic care management and how that might help with long-term sustainability. So I do want to revisit the Nosor simple definition of value from our last session. We talked about several definitions last time. But I'm a very linear thinker, so I tend to go with the most streamlined. So really, as a reminder, when we talk about value or moving toward value, what are we really talking about? And why do we need to make sure we're keeping this in mind, especially if we're just starting down the road from volume to value and developing processes and procedures? So we're really talking about our current system is based on numbers of services provided, numbers of procedures, numbers of tests, numbers of patient visits, those kinds of things. We're moving to a patient-centric, improving outcomes, quality delivery of care at a lower cost. So really looking for patient-centric, and I really kind of hammer that one, because when you start with the patient and end with the patient and everything's focused around the patient, you're doing something right to begin with. So really being patient-focused, improving health outcomes, helping folks become more well, doing it delivering those services in a quality, I might ask you what that means to you, quality way, ensuring that it's quality delivery of services, and with an eye to cost. And remember that we basically have three focuses when we're talking about value: payment incentives, coordination and integration of clinical services focused on prevention and wellness, and information sharing. Those are three key components to ensure that we are really moving towards value. But what's the big deal, right? You're like, what? Yeah, okay, whatever. I'm in a rural health clinic. I have an all-inclusive rate. Why do I care? Because I'm going to get paid the same rate no matter what I do. Well, maybe. But what about Tammy's Rural Health Clinic? I also have Blue Cross and Blue Shield patients, and that happens to have managed care, or your Medicaid in your state is now managed care. Oh, so you might be already in the value pool, kind of not knowing it. So that's why it's a big deal. It's a big deal because value is coming. We have to get our ducks in a row and make sure that we're ready, and hopefully, fingers crossed, we're ahead of the game, and we've already kind of dipped our toe in with some of these service line additions that help us, that drive us towards processes that inherently lead you to more value, lead you to a more, the perspective is more value driven. So even if you're getting paid under an all-inclusive rate, you have to care about this transition to value. Remember, what is the why we do what we do? The why is the story of value, and the root of value is medical necessity. Back to medical necessity. Remember, this is the first step towards value. It's the heart of services we provide. Every service has a purpose, or don't do it, right? That's called medical judgment. The medical necessity is really the why we perform the service that we're performing at that time. Or is there another option? And just because something is the right thing to do, and I'm using air quotes again, right thing to do, doesn't necessarily mean it's medically justified. So how do you make that distinction of, well, this is the right thing to do, but it's not medically justified? You answer these 5 questions. The answers to these questions not only establish medical necessity, but also intensity and complexity. Again, the heart of why we do what we do, it's the heart of value. What service is needed? Why are we performing it? How will the service be performed? Who will perform the service? And where will we do it? So when you're talking about connecting medical necessity and value, it's not a stretch. Because if the service is not medically justifiable, there's no value. The goal, remember, is to help our patients stay more well, not just treating the disease after it presents. Trying to move toward better wellness overall. So in your mind's eye, hear dramatic music playing in the background. If you don't remember anything else I say all day, remember, documentation is the cornerstone of the business. Incomplete documentation leads to incomplete coding, leads to incomplete billing, leads to incomplete reimbursement. There is a solid line correlation between quality, completeness, and accuracy of clinical documentation and revenue position. Let me say that one more time. There is a solid line correlation between quality, completeness, and accuracy of clinical documentation and revenue position. So I want to take this a step further. So we've introduced service lines as a way to demonstrate value. You're already doing it, take my word for it, you're already doing at least some of that work, whether you have a process and are billing for it or not. And I know this because y'all are rural providers. And rural providers historically have a more patient-centric service delivery style than our more urban and metropolitan counterparts. So a few questions to get us started. I would venture to guess, chronic care management is a service line that you're probably doing at least some of the work, but you may or may not have a process to dot all the I's and cross all the T's to bill for it. Am I right? Just checking the chat there. Again, especially with chronic care management and the newly introduced principal care management, remember chronic care management is 2 or more chronic conditions and principal care management is 1 chronic condition. That's kind of a simplification, but I think you get the distinction. Especially with those rural healthcare providers have, using air quotes, done this work historically. It's patient-centric and it's the rural way. Checking on Miss Sally to make sure she's eating. Checking on Mr. Sam because he messes up his medication sometimes. So these questions ought to be questions that you're asking yourself regularly. Are you currently providing chronic care management services? I guarantee you're providing at least some of them. Are you currently billing for it? Maybe, maybe not. Let's say in this case you're not. If you're not, why not? And if you are you actually getting paid? Because there is a difference, my friends, in billing for something and actually being paid for something. Sometimes it's a slight distinction, but it's a distinction nonetheless. So thinking about these questions. So if you are wondering if you're actually doing chronic care management, I've included the front page of the booklet here for you and the link. So when you get the slides, you'll be able to go right to it. So this handy dandy CMS resource, it's the one-stop shop for all things chronic care management. Like I said, when you get the slides, the link slides, keep it bookmarked on your browser to make sure you have the most current requirements at your fingertips. If you're not currently billing for these services, it might be worth taking a look to see what kind of lift there might be to get your policies and procedures in place to ensure that all the requirements are met and fully documented so you can bill. How difficult is that? Depends on the processes you already have in place, right? So, I went too far, sorry. So you could take this booklet and maybe a workflow, if you have it laid out already, of what services you're already providing and see where the gaps are. We're going to talk about that a little more in just a few minutes. But identifying those gaps and making sure that you can and have policies and procedures in place to make sure all the documentation is where it needs to be so you can bill. And remember, chronic care management is paid outside your all-inclusive rate. So how about thoughts on this question? How might providing chronic care management services move your organization towards value? It's like dipping your toe into the value-based world without jumping into a higher risk, like, say, an ACO or MCO situation. And since you're already doing some of this work, hopefully it's not too scary or administratively burdensome to stand it up. And again, remember, chronic care management is paid outside the all-inclusive rate. The RHPTP folks are more than happy to come alongside you to make sure that you have processes in place and to be your thought partner as you kind of go through the process of incorporating this or other service lines into your practice. So chronic care management is just one example of how implementation of a service line is like a jumping off point into the transition to value and can impact long-term organizational viability. So there are other examples, right? Nursing home. If you don't currently have a nursing home or home health part of your practice, those service lines might be something to explore. What about an urgent care? If there's no emergency room in your community, maybe that's a service line to examine. What about palliative care? Because remember, palliative care, it's any age at any stage, right? It's not like hospice. A lot of folks equate palliative care and hospice, and yes, someone can be on hospice and have palliative care. But palliative care is a group of codes that basically help provide comfort and increased quality of life in a nutshell. They are billable codes. There are billable codes for palliative care services. The problem is there are no payable codes. So what does that mean? It means you can bill for those services using their ICD-10 and associated CPT codes. The problem is there'll be a $0 reimbursement. So how do you provide those services? By augmenting with other service lines is one way to do that. And if you have interest in that, happy to chat with you about it. So now let's pivot to talk about how we might go about improving processes to enhance the way we provide services, like chronic care management. So what do we need to do in order to make sure all our I's are dotted and T's are crossed and that we are actually meeting all the requirements so we can bill for these services that we're providing? So, process improvement, what is that? I mean, what? So everybody knows what a process is. It's a way of doing things, right? It's the way your organization does a certain thing. So let's say that the way I check out a library book, the process is I go online to Granville County, that's the county I live in North Carolina, Granville County Library. I put in all my information and I apply for a library card. They send me a library card, and then I can go to the library and physically check out books. Or I can go to their online resources and use my library card number to check out books electronically. That is the process. So basically, process improvement would be what's broken in that process or what's not working, where's their bottleneck, how do we fix it? What's the best way? You know, every company, no matter what kind of company it is, has processes. The way they do whatever it is that they do, making widgets, making shoes, whatever. The better you can execute, the more effective your business becomes, right? Raise your organization's effectiveness by implementing process improvement. And when I say implementing process improvement, I don't mean look at one process and be done with it. This is something that, in my humble and often ignored opinion, should become part of your organization's DNA. Think of it as process continuous quality improvement because, my friends, that's exactly what it is. How well an organization implements and executes processes affects the effectiveness. Sorry, I should have used different words. Operational performance impacts all facets of the organization, from controlling costs to delivery of services to our patients. It also impacts patient experience, which we know is important when it comes to value because value is patient-centric. So making sure that you're paying attention to how your processes work, where there might be snags, and how to go about smoothing out those snags or obstacles is really important to the efficiency and effectiveness and ultimately the long-term viability of your business. We're striving for an efficient, systematic approach to minimizing errors, reducing costs, and achieving benchmark standards, maybe production and quality, maybe some other, depending on what your goals are. So when you encounter operational challenges or simply want to optimize existing workflows, like you're going to integrate a new service line, it's time to look at implementing process improvement. So we're going to identify an area where there are existing processes, but they're lacking in some way. Once the problem is identified, then it's about developing and implementing changes that optimize the existing process to meet or exceed whatever standards that you are dealing with. So some common ways to go about this, and I'm sure you guys know a lot about these different types. Some of them have been around for a long time. Kaizen is really about, it's continuous and never ending and aims to eliminate all waste from process flows and achieve high levels of efficiency and productivity. It's known for its team approach, where everyone in the organization has a say, which might be fun, and it might be a big undertaking. Six Sigma, that's probably one of the most famous, right? Designed to improve quality by eliminating defects or errors from a given workflow. Basically, you apply, strategies are applied continuously to a particular process until variations are completely gone and the process produces consistent and predictable results. And then, of course, PDCA, Plan, Do, Check, Act. It's exactly what it says, its name says. And you identify the areas requiring improvement, and then you apply the Plan, Do, Check, Act. Business process re-engineering. You may or may not be familiar with this, but this basically looks at process improvement on a huge scale. Instead of looking at one process or one workflow, it attempts to address issues and eliminate unnecessary steps by holistically redesigning an entire process from end to end. That might be a huge undertaking. And then gap analysis, very familiar with this. You examine where your business is today, where you want to be, and then what do you need to do to close the gap? And really, this is not limited to operational improvements either. You can apply this to like a market analysis for, and I'm using air quotes, competition, to improve profitability and even workforce shortages. So it's a little more malleable, if you will. And then, of course, process mapping. This is all about visualization. So being able to create the workflow or create the process and what the new steps need to be and make it visually appealing, I can't talk today, is important too. So it really allows you to see the entire process and identify areas that might need addressing as you're doing it. So some steps of process improvement, right? So you have to identify the challenge area. What are the pain points? What is a pain point? Bottlenecks, obstacles, where folks get stuck. Part of the process doesn't make sense. Those are pain points, the points that need to be addressed in order to make the process more streamlined. And then mapping that process, right? Once you know where the pain points are, it's, I won't say easy, but it's, it may help flag potential issues with as you change the process. Obtaining buy-in from the folks involved. That's really important, right? It's much easier to get folks to change when they have a say or they feel like they have a say. So as you're going through identifying the challenges, maybe you involve staff in that particular area. Maybe you ask patients or family members. So making sure that anybody that the change is going to impact has some ownership in that change. Then, of course, you get to designing and implementing the actual process improvement plan. What do the changes need to be? How does it need to work? What are the logistics? What's the timeline? Is there any cost associated with it? All of those things. Test those changes, see if they actually work. You might call that a pilot, right? Just depending. And then watching and tweaking as you need to. One thing this process does not say is you're done. So remember, you're trying to not only establish and streamline and enhance processes you already have, at the same time instilling this culture of continuous process and therefore quality improvement into your practice. So how do we use the methodologies we just talked about to really make something happen? So, as I said, once you work through the process improvement process, reality is you're going to revisit it again at some point. Goals change, markets change, new technologies evolve, making established procedures sometimes inefficient, sometimes obsolete. So maybe the way to go about it is to adopt an approach of small, iterative improvements that happen routinely over time. This is that culture change, right? This continuous improvement cycle is an approach that some organizations naturally kind of go through. So when team members make minor procedural adjustments to increase efficiency or a little tweak here, a little tweak there, no, don't send them to the lab this way, send them this way. It's 8 steps closer. The difference is implementing a framework that makes process improvement a conscious part of the organization's DNA will definitely impact long-term sustainability. That's when you're able to deliver operational excellence that keeps evolving to stay ahead of the game and deliver high-value, patient-centric care, helping our patients become more well. Remember, that's our why, the heart of value in the story of services we provide. So I want to talk about current service lines for just a minute. So do you currently have behavioral health integrated into primary care? If so, how's it work? Is it working for you? What's one thing you can do to move closer to having a reimbursable behavioral health program in your organization if you don't already? What are those pain points? If you can think about what those pain points are, identify them, so describe the services you currently have and what you want them to be, that may impact your transition to value as well. And behavioral health is kind of low-hanging fruit, right? It's one that back in the day, maybe early 2000s, there was a big push, at least in North Carolina, there was a big push to integrate behavioral health into rural health clinics.
Tammy, we are not hearing you.
Is that better?
There we go. Yep.
Okay, not sure what happened. Okay, so back in the day, I'm not sure exactly how much you heard. So back in the day, we had foundations that funded rural health clinics to integrate behavioral health, and it was wonderful. Folks got licensed clinical social workers. The patients loved it. We saw a great response. We saw positive changes in patient outcomes, and then the money stopped. What do you think happened? You're right. No more behavioral health. So ensuring that as you're adding service lines, that you are thinking through from start to finish that process. How are we going to do this? What are the logistics? Making sure that everything is in place, including the appropriate credentialing, coding, and that documentation is where it needs to be. So adding behavioral health, sorry, got mouse happy there. Adding behavioral health as an integrated service or as another service line definitely is an opportunity to have positive impact on your transition to value. If it's integrated appropriately, and if being the operative word there, you can enhance services delivered to patients even on the primary care side, and can definitely lead to improved patient outcomes. The process has to be smooth for integration to work seamlessly. All of the components have to fit together perfectly to complete the picture. And chronic care management again. Are you doing chronic care management? Are you billing for it? Are you getting reimbursed? Those are important questions. If not, is it just the process? You're doing the work, or at least part of the work. Where are the pain points? Where are the sticking points that y'all need to work on or work through in order to ensure that you can bill for chronic care management? What is one thing, one tweak that you can do to the current process to move one step closer to having a reimbursable chronic care management program in your organization? Again, it's definitely an opportunity to have positive impact on the transition to value, right? Chronic care management, there's tons of examples of how it has positive impact on patient outcomes. And remember, we're patient-centric. So if it has positive impact on the patient, those positive impacts are going to be felt in other parts, other components of the business. If workflow is seamless and can enhance services delivered to patients, the process has to be smooth, just like we said, and ensure that all the components, which in this case might be people, if different staff have different roles within chronic care management process, if that makes sense. Somebody's calling the patient, somebody's doing a home visit, somebody's looking at medication, somebody is talking about nutrition. So there might be lots of hands in it. So there may need to be some coordination of those components to help them fit together personally. When it does, chronic care management, and it's the same for principal care management, helps us tell the story of the services that we provided. And again, here's the front page of the booklet with the link for you. Palliative care, already talked about this a little bit, billable but not payable. How might you integrate these services and make them sustainable when they're not payable? It is possible to help augment with other service lines, but that is something, that process is a little more complicated and will need some thought behind it as you're really moving in that direction. What are other service lines that your community has need of, but your organization hasn't yet considered? So if you will think, what is one thing we can do to move closer to having a reimbursable inter-program name in here for your organization? Is there one? Is there one? Is there a need that your community has? How can you do a gap analysis and meet that need? So as we start to wrap up, what is one takeaway from today's session? What's one tidbit that you can walk away from? And I hope at a minimum, it's documentation is the cornerstone of the business. Remember, incomplete documentation leads to incomplete coding, leads to incomplete billing, leads to incomplete reimbursement. That solid line from clinical documentation to revenue position. I hope you'll continue to learn with us as we have one more session in this 3-session series. If you have questions, in addition to the folks at RHPTP, you can tap your State Office of Rural Health when you don't know where to go. State Offices of Rural Health are really that one-stop shop for rural health expertise in your community. That's really why we're here. So what kind of questions do we have? Do we have any questions in the chat box? Sorry, I clicked too fast.
No question.
Okay. So I did put some resources together for you, some lists of web pages, and these links are live when you get them. Everything from the Rural Health Clinic Center to critical access hospitals at CMS, the rural providers and suppliers billing chart, that's really handy to keep at your fingertips. And then other partners. And as I said, your State Office of Rural Health and the RHPTP folks are always available for consultation. And I'm available too. We're here to provide support remotely, and we're happy to field emailed questions and other remote support as you need. The important thing to remember is you're not alone. There are lots of folks trying to provide these and other important services to their patients all across the country. Help us help you. And in turn, you might pave the way to move the power of rural forward and help your rural community become more well. I want to take a moment and thank Kiona and the RHPTP team and Angie, y'all are awesome, at the National Rural Health Resource Center for the opportunity to spend some time with y'all. I hope you found some value in our time together today, and I look forward to seeing you at our next session.
Thank you, Tammy, for some just really insightful strategies and various models or processes that I think will help us all be able to take those steps from moving to from volume to value. We're certainly looking forward to the final webinar in this series, which is the first steps and next steps in the transition from volume to value. That webinar will be held June 30th from 1 to 2 p.m. Central Time. Before signing off, I would like everyone to answer one additional poll question. Let's see here if I can pull that up for us. So same question concerning my knowledge of services to jumpstart and assist the transition from volume to value. I feel while you all are working on that, I want to remind everyone that today's webinar recording will be available on the Help webinar page of the center's website within 5 business days. I've just added to the chat box the link to the SurveyMonkey assessment for today's webinar. If you would like to receive ACHE credit for today's webinar, we will need you to complete the survey. And also I've posted the email address. If you have any questions for our RIP TA team, we would be happy to assist you with that. As always, we encourage you to reach out to us with any questions. Thank you again, Tammy, and everyone for your participation. I've got one final poll. And Kiona, maybe you can help me out. I am not able to pull up the final poll.
Angie, Keon is not on right now.
Well, she's not.
That's okay. We'll just go ahead and sign
Okay.
off. Thank you.
All right. Thank you, everyone, for your participation. We'll see you next time.
Thanks, y'all. Take care. Bye-bye.
Bye-bye.